Hello, Doctor's Digest Nation. So this is Dr. Palmer, and what we're going to do today, this is my wife Kim. She, if you've been to our office, you probably met her. We've been married for 32 years plus. It'll be 33 years in August. Anyway, today's video what we're going to do is I'm going to show you how to eliminate a headache really quickly. Now, this isn't every headache, because obviously there's a lot of different reasons why a person can have a headache. But most headaches are caused by neck dysfunction, and a lot of that is muscle sometimes. So if you do this and you don't find the same things or you don't get the same result, then there's probably a more serious issue going on, and I would consult a chiropractor or a therapist or whoever you're comfortable with. So what we're going to do is my wife, actually, the reason that we're doing this video is my wife had a headache a couple days ago. And so I did this process to eliminate her headache almost immediately. So what we're going to do is we're going to start working in the muscles of the neck. So the trapezius muscle, there's the SCM, there's the scalenes, levator scapula. It doesn't really matter what the names are. But what we're going to do first off, if you can have somebody help you, if you're the one with the headache or if you're trying to help somebody who has a headache, the first thing I want you to do is just go in and very lightly ask for feedback from her. Go ahead and just look straight ahead. You're just going to push on the muscles very lightly. So you're going to come in and you're going to do just a little bit of light pressure. And you'll do it on both sides. And what you're looking for is when you do this light pressure into the muscles of the neck like that, you want to ask the person you're working on, did one side help better than the other? And in the case of that night, she said it was this side. When I pushed on it, it actually affected her headache. She got kind of a referral pain up into the base of the skull. So then what you're going to do, once you know which side you're on, then what you're going to do is you're going to come in and you're going to start to put a little bit of pressure. And again, you're going to ask the person you're working on to give you feedback. This isn't going to feel really great, but what you're looking for is you're going to look for, when you're palpating the muscles, you're going to look for muscles that are kind of a really tight band of muscles. So when you come in and you're feeling and palpating and putting pressure in here, going along from about about 2 inches from the edge of the shoulder up the neck, you're going to start putting pressure in there, and you're looking for bands, like really tight bands of muscle. If you go up in here and you start to palpate and you find a band of muscle that's really, really tight, then what you're going to do is you're going to focus on where that band is, and you're going to start to apply some pressure. Now, as you start to apply the pressure, again, you're not ramming in there really hard. You're just pushing down, and you're getting feedback from the person you're working on. And in the case of Kim, when I was working on her, she gave me feedback. She said, it's actually taking my headache away. But before that, it was hurting, right?
Right.
It was like referring, it was kind of a referring pain up the skull, and that means you're on the right spot. And so you're going to just hold that pressure for about a count of about 12 to 15, and then go ahead and release it. And then if a little bit more than that is what you can do is try to trace that muscle over where it ends up. What we call it is origin insertion, but again, you don't need to know all that. You're just basically trying to trace where that muscle goes from one end to the other. And so you've been probably on the belly of the muscle, right in the middle of it. Go down and kind of trace that muscle and then push there too, and see what happens to the person you're working on. See if it helps or if it's not doing anything. And if it's helping, then again, do 12 to 15 seconds, hold there. Pressure, and then go and follow that muscle to the other end, and again put pressure there, getting feedback from her or him, and again putting pressure there, seeing if it's helping or hurting. So what happens is that when you're pushing on the muscle and you're holding for a count of 12 to 15 minutes, or 12 to 15 seconds, this is a trigger point therapy type of exercise, and it's going to cause that muscle to relax, and it's going to help that headache, and oftentimes it can eliminate that headache. Okay? All right, so thanks for watching.